Hey y'all, it's Ashley IBCLC, and today we're going to be talking about hand expression. Hand expression is exactly what it sounds like. It is collecting milk with your hands instead of like with a pump or a haka or some other collection device. Literally the simplest way that you can collect milk. Now, there is a bit of a learning curve, which is why I'm making this video. A lot of people just don't really understand fully how to do hand expression. So that's what I'm here to show you today. First, I want to help you understand normal human breast anatomy. This part is your areola, this part is your breast, and this part is your nipple. Now, in people of color, the areola is going to be darker than in white people. You can see that most white people have like a pink or a light brown areola and nipple, and people of color have darker areolas and nipples. That's important to distinguish because a lot of texts and a lot of education is focused on white anatomy. Me personally at Kentucky Breastfeeding Center use Melanated Mammary Atlas to look at pictures of people of color because certain conditions like thrush or mastitis can look different. We want to make sure that we are supporting people appropriately. So like I said, breast, areola, nipple. This is important to distinguish your areola from your nipple, because stimulation of the areola and stimulation of the nipple are two very different things. Stimulation of the nipple has been shown to cause contractions if you're doing this while you're pregnant, whereas stimulation of the areola doesn't necessarily do that. There is not good research in breastfeeding, period. There's not good research in women's health. So when I talk about hand expression during pregnancy or colostrum collection during pregnancy, just make sure that you discuss anything that you are planning to do while you're pregnant with a care provider or a lactation consultant, because those people will know your health history and know your risks and be able to educate you on those. Now, located behind your areola in the wall of your breast are milk ducts. And when you're hand expressing, it's important to compress those milk ducts because that is what is going to eject the milk. When you are pushing back into the wall of the breast, which I'll get into the technique a little bit later, you're going to compress those milk ducts and you're going to bring that milk forward. Just as a baby would with their mouth, they're going to latch onto the breast, they're going to compress, and they're going to pull the milk out. So that's kind of what we're mimicking here. So I talked about the stimulation of the nipple causing contractions potentially in pregnant people. The reason for that is because stimulation of the nipple can cause the release of oxytocin, and that is what causes your letdown or your milk ejection reflex. So that's what causes your brain to tell your breast to make milk and push the milk out. When you are hand expressing, you are not focusing on the nipple, you're focusing on the areola. So we're just kind of compressing and getting what's already there out. So a lot of people think hand expression is like massaging. So we're massaging our breasts, we're moving the milk, we're doing all of these techniques, but really what we're going to focus on, like I said, is the areola. So what you want to do when you're hand expressing is you want to take two fingers on either side of your breast. Now you can do it parallel to each other on the sides, top and bottom, diagonal. You want to do just your fingers across from each other where the areola meets the wall of the breast. So what you're going to do is you're going to push back and you're going to roll forward. Now this isn't just one fluid motion. What you're actually going to do is push your thumb and then your finger and then roll forward. So we're doing kind of a motion like this, but it will end up being more of a fluid motion when you do it. So you're going to push back, compress those milk ducts, and roll the milk out. Notice I'm not touching the nipple. We're going to do the same thing here. Push and roll forward. Now what you don't want to do is pull or stretch that skin. We're just simply pushing back into the wall of the breast. So we're pushing back and rolling forward. And like I said, do this all over your areola. Let's distinguish between hand expression and colostrum collection prior to delivery, which is called antenatal colostrum collection, and postpartum colostrum collection. The reason you would want to hand express when you're pregnant is because this can be kind of an insurance policy. So you would essentially express into a syringe or a colostrum collector or a cup or a spoon, and then put that milk in the freezer for after delivery. So it's going to stay in the freezer until you deliver, and take that with you to the hospital, leave it at home, have somebody go back and get it when you need it, if you need it. You'll feed that to baby after delivery in case they need to be supplemented. So this is really helpful for people who have gestational diabetes and their baby might potentially have blood sugar issues after delivery, induction due to high blood pressure. There are lots of different reasons that you would want to collect colostrum during pregnancy, but as I discussed before, we want to make sure we clear it with a healthcare provider. Now, colostrum collection after delivery is a little bit different. The reason that I want you to collect colostrum, if it's a good fit for you prior to delivery, is because we don't know when those issues are going to arise, and when they do arise, it's very stressful. So it's hard for you to get a proper technique and to remember to hand express or to ask for a syringe or a pump or anything that you might need. So it gets to be really stressful in the moment. It's exactly why in my other video, I recommend getting your pump out and playing with it before your baby even arrives. When your baby needs milk and you're stressed, it just makes things a little bit harder. So the reasons that you would hand express after delivery would be you and your baby are separated. Your baby doesn't latch. Your baby has to go to the NICU. You're not responding to the pump because colostrum is really thick and sticky and hard to get out. So hand expression is more effective. In the first 3 days, if your baby isn't peeing and pooping enough and you feel like they're not getting enough, they're not transferring well at the breast, that's what that means. And giving them an extra boost with your already expressed colostrum or your currently expressed colostrum is going to help so that you don't have to use formula. Now, there are plenty of hospitals who do utilize donor milk, and there are hospitals that don't. So I definitely recommend asking your OB or your midwife, wherever you're going to be delivering, if you do have access to that. And if you're having a home birth, I highly suggest talking to your midwife about your options. One of the arguments I get about colostrum collection is if I'm expecting a full-term healthy baby and I'm a healthy individual and I don't have any other risk factors, why would I need to collect colostrum before delivery? Because I'll have all the colostrum I need after. And that is very true. That's a great argument. And for most people who are young, healthy, have no underlying health conditions, you're probably fine not to collect colostrum. Just as a personal aside, for my first 2, I did not. Everything went well. For my 3rd, I did collect colostrum because I had gestational diabetes and I assumed she would have blood sugar issues, and I was right. So I burned through the colostrum that I had collected during pregnancy, and I was having a hard time keeping up with feeding and also collecting colostrum in the hospital, so I did utilize donor milk. Overall, hand expression can be a really good tool for people who are just really not sure how breastfeeding is going to go and want that kind of insurance policy, and for people who are just not responding to the pump directly after delivery. Thanks for watching, and subscribe for more breastfeeding info from Ashley IBCLC. Hope to see you in the next one.